Okie dokie. Are we almost ready? Are we? Good, and we are back with you. Sorry for some technical difficulties. New technologies always breed interesting new challenges or great opportunities to be nimble, quick, and very flexible. So we are thankful to be joined back by Dr. Rachel Vreeman and to continue this conversation around the Indiana Miracle Offering for Global Health, benefiting Imagine No Malaria and the Global AIDS Fund of the United Methodist Church. So Dr. Rachel, who is experienced in many things, from lots of different aspects of life, but very professionally in the aspects of pediatrics and also HIV/AIDS research with children, has joined us this morning to talk about that. So we hear that we have some questions from you guys, and we want to be able to entertain some of those. So let's see. I'm going to pull up my Slack here and see what we've got as those might come in just a second. So Rachel, tell us also too, kind of what are, as you connect, are you seeing better awareness happening in areas over the, how long has IU been involved in Kenya now?
Sure. So we've had a partnership in Kenya since 1989. So really for quite some time now, 27 years. The HIV treatment program that we run together with Moi University School of Medicine started in 2001. So over these last 15 years or so, we've really seen a lot of changes. Before we started that partnership, no one in Kenya was receiving HIV medicines. People were just coming to the hospital to die. And that was really what led us to get into this. We didn't set off with the goal of starting an HIV treatment program, but we couldn't ignore all of the patients and people and friends dying around us. And that led ultimately to our partnership in Kenya, launching this HIV treatment program that's now cared for more than 200,000 patients. We have 65 clinical sites. And in the work I do, we follow about 15,000 children and adolescents with HIV.
Awesome. Very good. I think it's always just one of those things. How important is it for us as, just anyone, as an individual, to think about the health of someone else, the health of the world? What does that mean for, the world when we just think outside of the box a little bit and think about our neighbor?
Yeah, I think it is a hard thing for us to make that jump. We each are so busy with our own lives and our own challenges that to think about the lives and health of people far off in different parts of the world seems kind of distant for some of us. But I think it is a jump of compassion, of empathy that we can make, to think about the fact that, these are mothers and their babies just like us. These are our brothers. There's nothing different about the people that are in another part of the world other than they're in this different place and they may have access to a different set of resources. But these are parents with exactly the same hopes and dreams for their children that any of us would have for our children. These are sisters who want the very same things for their brothers as any of us would want for our family members. And when even though we can to some extent think we can ignore, this HIV problem is something that's far away and in other places, it should touch us that 1 million people are still dying every year from this, from something that we know how to prevent, that we know how to treat. And even if it's even if that argument doesn't get to you or have to understand, it is also an issue here. We're seeing in the state of Indiana over the last few years, we've seen a big spike in HIV infections in ways that many of us never would have guessed that in small town Indiana this would be a problem. But it's really a problem everywhere. And, when one part of our world is suffering, we're connected in ways now that can't be ignored. It makes a big difference for the economies in these places. That makes a difference for our economy. It makes a difference for the safety and stability of countries in terms of the level of poverty, the level of health. When other countries are healthy, when their people are able to work and to prosper, that makes all of us safer. That makes all of us better and more thriving in terms of, even our economic possibilities in that way.
Very true. So here's one question that we have. Are there drug companies making significant contributions to third world AIDS treatment?
There actually are. So we, in terms of drug company involvement, so there are sort of two ends of this. So one is that we have really pushed for generic medication options for people in developing countries to have access to, so that the medicines would cost less, and that does make a big difference. But we do also see drug companies making significant contributions now, more and more. One of the things that we really try to push with some of these companies are things like, even though it's not going to earn them any money, developing formulations that work for small children, developing the kinds of third and fourth line options that we need for patients, things like that. We do also see drug companies often coming to help and support us with, for example, in our partnership in Kenya, we get a lot of resources around medicines for mental health, medicines for diabetes, some of the things that are, because we're able to access generic medicines for HIV, we end up having a real need from drug companies to help us with some of the other health challenges that our patients are dealing with, just like any set of patients. So even in cases where they're not providing HIV medicines specifically, there are provisions for other types of medicines that we really do critically need. That being said, we're always happy for more involvement and for them to keep pushing with the idea of how do we, have better treatments for a disease that mostly affects poor people.
Yeah, it's very true. It's very true. And what other strides are being made in the effort to prevent HIV/AIDS and or also provide treatment?
Sure. I think there are two incredibly powerful advances related to HIV that not nearly enough people know about. So one is that if you're infected with HIV and you are on treatment, we ideally are bringing the level of the virus in your blood to such a low level that it's undetectable. That's our goal for every single person with HIV, is that we bring the virus down so low that it's undetectable. And if that's the case, it is incredibly unlikely that you would infect another person. So we basically can prevent new infections by treating people who are infected with HIV. Infected people who are on treatment should not infect others, and that really is our goal. That's the biggest way we're probably going to stop the epidemic. The other advance that not nearly enough people know is that by taking one of the HIV treatment medicines, but just one of the single tablets, taking that every single day, if you're not infected, you can prevent yourself from being infected. So we have an incredibly good way to prevent new infections. Taking, we call it PrEP, but taking a medicine that you take once a day that prevents you from getting infected can prevent new infections as well. So we actually have two incredibly great ways to stop the epidemic. And as I happened to mention earlier, we also know how to prevent mothers from infecting babies. So we should be able to prevent children from getting infected as well. So we know how to prevent HIV, and really we know how to treat it. We still don't have a cure. That's something that scientists are working on like crazy. So once you have the virus, we can't completely kill it, but we can make it sleep. We can get the level in your body so low that it's undetectable and that you don't infect other people.
I imagine, this is, things that are recent strides and available more and more to the public.
Yeah.
But imagine what, the 70s and 80s would have been, and early 90s would have been like in our society in America, had that, those medical, strides been available at that time. The conversation could have been a lot different, and a lot of people would still be with us.
Yeah.
So talk to us a little bit more about PrEP. What does PrEP stand for?
PrEP stands for pre-exposure prophylaxis, which means that it's a medicine you take before you're even exposed to the virus, and it's prophylaxis. It protects you from getting infected. So as I said, it is actually one of the set of medicines that we use in HIV treatment as well. Truvada is commonly one of the names of one of the PrEP medicines that are used, but that's something that's widely available. If it's something of interest to you, if you ask your doctor, any general family doctor or internal medicine doctor and so on, they should be able to prescribe that for you. It's widely available in the U.S., and it's something that we're trying to make more and more available in settings where I work in sub-Saharan Africa, because we've seen how incredibly effective it is. And since we do not have a vaccine yet, since we do not have a cure yet, something like having as many people as we can take PrEP or take this medicine to prevent HIV is really something we think about. How can we do that on a large scale for people?
Awesome. So as you look about and think about, so PrEP is, or Truvada is one of the, applications for PrEP. It is something that helps prevent it. Talk to us a little bit about, the application of that. What does it look like? You have to get tested.
So you have to get tested for HIV, so that way you figure out if you're infected or not infected. If you're infected, then we want you to start on treatment right away. And like I said, our goal then is to bring the level of the virus down so it's undetectable. And ideally, we can start people on treatment, before they even start to get sick, so you can remain healthy for a long, long time. So you get tested. Then if you're not infected, that's the perfect time to start PrEP, because we know you're not infected. You can start taking the medicine. You'll be protected that way going forward in terms of what happens next in your life. Of course, we still encourage people to think about ways to protect themselves from infection in other ways. And at times we might with that periodically do blood tests to make sure that everything like your kidneys and liver and so on are doing fine with it. But it's actually an incredibly safe medicine. The biggest key for PrEP is that you need to take it every single day. It doesn't work if you don't take it.
Yeah.
And of course, for all of us, taking a medicine every single day is a challenge.
Yes, so. It is. It's a routine.
Yes,
But
exactly.
it's something that can provide life-saving measures for you. So
Absolutely.
As we think about all of that. None of that is possible if you don't get tested. So, to know your status and to be able to receive treatment to basically save lives and also reduce the virus in your own bloodstream so that you can prevent infecting another.
Yep.
Or to access medicines that help prevent HIV, and to really, what it's I can't remember the percentage, at the current moment of, how effective is it? PrEP?
It's incredibly effective. I think I'm trying to remember the exact percentage. I think it's over 98% effective. It's really well.
Yes.
It does great in that sense. And the thing with getting tested is it's a scary thing. Even if you know that you're not infected, or you think it would be incredibly unlikely, it's scary to get an HIV test. I know, but it really is the only way to effectively keep yourself healthy, because you know then what you need to do next. The other thing is, not only is it a benefit for yourself, but if you think about it, if we could just make HIV testing a more regular thing, it really would help to break down this stigma that's all around us. If we could, if by each of us saying yes, of course we're going to get tested for HIV, we're going to do it, several times a year, we're going to do it as often as we need to, that alone and that multiplying would really go a long way to try to reduce the stigma that surrounds HIV still.
So, thinking about that in a local context, if you are uneasy getting tested at your, regular family doctor, and some of us go to doctors that have been our doctors for most of our lives, and they know everyone in our family. First, let's be very clear. Your doctor is your doctor, and they have a code of ethics that they are there for you at that time, and not sharing any of your personal information with anyone else. So you should trust your doctor in that regard. But in case you are uneasy in that conversation, because sometimes it is difficult to go to your, the person who is your pediatrician from the day you were born to now.
Yeah.
There are other centers, and throughout the state, there you can go to be tested. One here in Indianapolis is the Damien Center. Correct?
Absolutely. Yeah.
So I encourage you to find access to those. And also, what would it look like if our churches also became community partners and provided access to training, testing, and also education?
Absolutely. That's something we talk about in Kenya quite a bit, because church is such an important part of many people's lives, and I think it's something to think about here as well. We've seen that it makes an enormous difference if church is a safe and supportive place where if you're infected or your family is infected or someone in your family, you can ask for help and receive support and encouragement. Even if it's not financial support, you can receive, encouragement and love and all the things that we would hope that your church is doing, that churches, kind of wrap around people in loving ways. On the other hand, we see way more examples where church is the last place that people want it to be known that they have HIV. Terrible examples where they see people with HIV called out as being sinners, as being condemned to hell, all of the worst sorts of things. And so what kind of atmosphere and attitude you can create within your church, especially in practical ways like this that are actually, demonstrating like, yes, we care about your health and about you in a way that, is so tangible that we want you to get tested. We want to make these things accessible to you. That makes an enormous difference in people's lives.
Yes, very much so. So I think it's important for all of us to know that our Methodist churches and clinics in Africa are trying to do just that and create spaces that are safe for people to engage in conversation and education, to get tested, to know that they are no less than, and to understand that this is not the death sentence that it used to be. And it's very important for that to happen. And we also can be partners here in America to do the same thing for our communities and also to help those abroad. And this is a great opportunity with the Indiana Miracle Offering for Global Health that benefits Imagine No Malaria and also the Global AIDS Fund. So if you'd like more information on that, visit inumc.org/global health. We are at the end of our time, but I'd like to thank as my dear friend, who I lovingly call Dr. Rachel, for her time in sharing so much knowledge with us and her expertise around this issue. She's got to run to other meetings and other things, but I really am thankful for you, Rachel.
Well, thank you. It was really a pleasure to do this.
Awesome.
You're very welcome.
Thanks.
Thanks.
Bye, everyone.
Bye.